How many ribs are in the human body? Anatomy of the rib cage. Vertical bar function of the rib cage, potential issues with the rib cage, variations in rib number, evolutionary history of ribs, clinical significance of rib cage, maintaining a healthy rib cage. Vertical bar. The human body is a marvel of nature, with each part having a specific function that keeps us alive and healthy. One of the most important structures in our body is the rib cage, which protects our vital organs such as the heart and lungs. But how many ribs are in the human body, and what role do they play in our overall health? Anatomy of the rib cage. The rib cage is a bony structure that surrounds and protects the chest cavity, which houses the heart and lungs. It is made up of 24 ribs, 12 on each side of the body. The ribs are attached to the vertebral column, the spine, at the back into the sternum, the breastbone, at the front. The first 7 pairs of ribs are known as true ribs because they are directly attached to the sternum by costal cartilage. The next 3 pairs of ribs are known as false ribs because they are indirectly attached to the sternum by costal cartilage. Function of the rib cage. The rib cage serves several important functions in the human body. First and foremost, it protects the vital organs within the chest cavity, including the heart and lungs, from injury due to trauma. Additionally, the rib cage provides support and stability to the thoracic region of the body, which allows us to breathe more effectively. The muscles between the ribs, known as intercostal muscles, help to move the ribs during breathing and play a crucial role in the process of respiration. Potential issues with the rib cage. Although the rib cage is an important and resilient structure, it can be susceptible to a variety of problems. Fractures of the ribs can occur due to trauma, such as a fall or car accident. These fractures can be painful and may result in difficulty breathing. Variations in rib number. While the standard number of ribs in humans is 24, there can be variations in the number of ribs due to genetic abnormalities or developmental anomalies. How many ribs are in the human body? Some people may have an extra rib, known as a cervical rib, which is located above the first rib and can cause compression of the nerves and blood vessels in the neck. This can lead to symptoms such as pain, weakness, and numbness in the arms and hands. Evolutionary history of ribs. The rib cage is not unique to humans, and has evolved over millions of years in various species. In fact, some of the earliest vertebrates, such as fish and amphibians, did not have ribs at all. Instead, they had a more flexible and cartilaginous structure that allowed for greater movement and mobility. How many ribs are in the human body? In humans, the evolution of the rib cage has been influenced by a variety of factors, including changes in posture, locomotion, and diet. For example, the development of bipedalism, walking on 2 legs, in our early ancestors led to changes in the shape and orientation of the rib cage to help support the weight of the upper body. Clinical significance of rib cage. The rib cage can be affected by a variety of medical conditions, including injuries, infections, and tumors. One of the most common injuries to the rib cage is a fracture, which can occur due to blunt trauma, such as a car accident or fall. Treatment typically involves pain management, rest, and sometimes surgery if the fracture is severe or causing complications. Infections of the rib cage can also occur, such as osteomyelitis, which is a bacterial infection of the bone. This condition can cause pain, swelling, and redness in the affected area, and may require antibiotics or surgery to treat. Tumors of the rib cage can also be a concern, such as osteosarcoma, which is a type of bone cancer that can affect the ribs. Symptoms may include pain, swelling, and a mass or lump in the affected area. Treatment typically involves a combination of surgery, chemotherapy, and radiation therapy. In addition to these conditions, there are also several surgical procedures that may involve the rib cage, such as thoracotomy or rib resection. These procedures may be necessary for treating conditions such as lung cancer, thoracic outlet syndrome, or other chest wall abnormalities. Maintaining a healthy rib cage. While the rib cage is a strong and resilient structure, it is still important to take steps to maintain its health and function. One of the most important ways to do this is to maintain good posture, which helps to distribute weight evenly throughout the rib cage and prevent strain or injury. This includes sitting up straight and avoiding slouching, as well as maintaining proper alignment of the spine and shoulders. A diet rich in nutrients such as calcium and vitamin D can help to support bone health and prevent conditions such as osteoporosis, which can weaken the bones of the rib cage and increase the risk of fracture. Conclusion: the rib cage is a vital and complex structure that plays a crucial role in our overall health and well-being. While injuries, infections, and tumors can affect the rib cage and cause a variety of symptoms, there are also several steps that we can take to maintain its health and function. This includes maintaining good posture, engaging in regular exercise, and maintaining a healthy diet. By taking these steps, we can help to support the health and function of the rib cage, and reduce the risk of injury or complications.